All right, Dr. Alan Boroditsky is with us. Now, Caitlin is our Sun Run ambassador, so she's going to be, she's been doing a lot of things getting ready for the run, and so she decided that she wanted Alan in here to ask him questions. That she has a running group, and there's been a lot of questions raised from her running group. So
yeah, it's nice that we got a whole bunch of people, and everybody's at kind of different stages, so they have different backgrounds in terms of running injuries and stuff, but some very common ones. What are some of the most common injuries that runners specifically face with their feet?
I would think probably the most common thing that we see in the office is plantar fasciitis. It presents initially as heel pain. Pain first steps out of bed in the morning is one of the more common signs, and then pain with activity. It gets worse with activity. So the more you're on it, the more it hurts. You rest, it's relieved. But that classic sign of pain first steps out of bed is often the sign of fasciitis.
how do you stop that? What do you do?
Well, most of these things are happening from an overuse injury. So you have to look at sometimes the shoes you're wearing, which I brought a couple of samples here today. A lot of people are training in inappropriate shoes. So this is an example, for example, of a shoe that doesn't have a lot of support. It has no what we call midsole. It has a rubber sole and nothing for shock absorption. So when you take a shoe like this and you twist it, and you could do something like this, that would be an example of a bad shoe to do a run in, or a shoe that you can push down like that. As compared to a shoe like this, which is a little stiffer in here and a little bit more rigid here, it would be a better shoe to use.
Are the companies now coming out, and the reason why I ask this is because we're dealing with it in soccer shoes. My wife was getting some soccer shoes. They're trying to make them so light that they're taking away that support on the ankles and stuff. Are you seeing that in running shoes as well?
They're always changing the shoes. Even a favorite shoe that you might have, you go to buy it next year and there's something different about it. So yeah, they're always changing it, trying to tweak it. We go through trends. Minimalistic shoes have been a trend of late. We're getting back into more stable shoes again. But the thing is, one shoe isn't right for everybody. It depends on the anatomy, it depends on the foot type, it depends on the biomechanics.
Now I know that Caitlin, you've had problems with your shins in the past, but would the kind of shoe maybe help to absorb the shock and help ease her?
It can, yeah, it can. It depends again on the patient how much they pronate, for example, as to whether or not they may need a motion control shoe or a neutral support shoe. But those are called mechanical injuries, and they're often related to the patient's biomechanics, anatomy, and running styles.
Now, with plantar fasciitis, rest is one thing, but can you use an insole or something else to put into a good shoe, but that will help ease the pain of plantar fasciitis? Because we're a couple days away, rest is not an option.
Probably the best advice is stretching. Stretching the calf, which we call the gastric soleus complex, but the calf muscle. Doing those kind of stretches after you warm up a little bit are very important, and doing them several times a day. Ice is also a very, very helpful thing to relieve inflammation in the area.
What about we were talking yesterday that the ball that has sort of like points on it, you know, the hard ball that you roll on your foot, on the bottom of your foot. Is that something that can help?
Massage is very good too, gets blood moving. I tell people often to freeze a 500 ml water bottle and use that for a little bit of massage, but several times a day is very helpful. The other thing to note is that it's not always plantar fasciitis when you have foot pain or heel pain, and that's something to point out. You could have something called a stress fracture. And a stress fracture is a compromise of the integrity of the bone. And we see a lot of that type of stuff too, again from inappropriate shoes. Here's an example on screen. One of the key signs for a stress fracture is swelling. This is a stress fracture of the forefoot. I think it was the third or fourth metatarsal. We might have an x-ray of that. Often patients will even run through that. So you can see in the x-ray here, there's a bit of cloudiness on the fourth long bone there called the metatarsal. Now, often x-rays are negative initially. So a patient may come in with swelling and bruising and point tenderness on the bone, and the x-ray may be negative. It doesn't mean they don't have a stress fracture. It just means that the x-ray hasn't caught up to the healing of the fracture. They're so small to see.
And you were saying people might run through that because do they even, I mean, they might just feel a little bit of pain and not realize how serious it is.
Yeah, or the adrenaline of it as well.
And is it an actual injury, like when you break your arm or you break your leg, you injure it, as opposed to the stress fracture? Is it from overuse and it's kind of not something you
will feel it. You will feel a stress fracture. It will hurt you, and you will have a sign of swelling. Maybe not bruising initially, but you will have swelling and you will feel it. The adrenaline of the run may take you to run through it, or you're training.
Right.
But don't ignore these kind of signs.
Yeah. Now you sent another picture along as well that we want to show, and this is what I've seen a lot of people have.
Yeah.
Tell us what this is.
This is actually a very common problem. This is called a subungual hematoma, which means blood beneath the nail. So when the nail is released from the nail bed, you can get blood underneath there, and it's captured in that area. And the problem with it is that the nail does not adhere back down to the nail bed. So when the new nail starts to grow in, you have all the blood in the old nail in the way, and it starts to jam up. And what happens is the new nail will grow quite thick. It will often dive down into the nail bed, and eventually the old nail will come off, and that nail may take several months. In the acute phase, when it first happens, if there's a lot of blood under the nail, it's often quite painful. Yeah. And if it's loose back near the nail bed, it will often hurt. And at that time, we often will remove the nail and allow to clean it up and allow the new nail to come in. So leaving these type of things can be a problem for the future nail that grows in, which can lead to permanent nail disfigurement and also even things like fungus.
Orthotics or not orthotics?
Good question. Not everyone needs orthotics, but orthotics for the people that do need them are very, very helpful.
And the only way to know is kind of to go see a podiatrist and get
a proper evaluation, have a biomechanical evaluation, and have appropriate measurements taken.
And can that change? Because I was using orthotics for about, I don't know, a year, and it was fine, and I liked it. And then after about a year, they started to bother me, so I took them out, and I'm feeling fine without them too.
Yeah, it depends on why you were prescribed orthotics in the first place, what was the purpose of it.
Right.
But generally speaking, for biomechanical faults due to anatomy and the mechanics of one's body, orthotics are often ongoing.
Yeah.
But if you're treating it for a certain injury per se, then you may use it temporarily.
Right, right. Well, ask me again after.
One more question about, as we get closer to race day, a little bit of discomfort in new shoes is understandable, blisters, but how long should you wait before you say, these shoes are just not working for me and I shouldn't wear them on a run like a 10K run?
That's a good question. I don't know that there's a specific amount of time. Certainly I would tell people to wear shoes in and around the house for a couple days to see if they feel good. For example, someone with a bunion, which is a bump on the inside of the foot, the big toe joint, may be bothered by having a shoe with a little seam that sits right over that bunion. So they may not feel it initially when they start walking around in the store, but when you start running in it, for example, you may get a blister or the bunion might become inflamed. So that's something you won't know until you start running around with it. But I would say generally after you've had a couple of activities in it, a couple of runs, a couple of good walks. If you're still seeing blisters, then there's a problem.
All right. Well, if you want some more information, you got a great website. Tell everyone your website.
www.alliedfoot.com.
It has all the details on there.
Good run tips as well.
Yeah, and you're all set to go. So go to the website and we'll see how you do. She's in for a record time, we can tell. She feels healthy right now, which is a positive.
She'll do great.
Record time? For who?
No pressure, Caitlin. Dr. Boroditsky, thank you very much. Good to see you again.
It's my pleasure. Thanks for having me.
8:42 in the morning news. We'll take a break and be right back. Stay with us.